Good afternoon, everyone. It is 2:00 and this is the SURG meeting, the December 13, 2023 SURG meeting. AG Ford is on his way here, so he will be just slightly late, but we're going to go ahead and get started with the agenda. And this is Terry Kearns, for the record, acting for AG Ford until he gets here. So to start off with, on our agenda, all the statewide substance use response working group, SURG, may take agenda items out of order, combine two or more items for consideration, or remove an item from the agenda or delay discussion related to any item at any time. And the meeting chat functionality may be disabled or limited to inquiries regarding technical difficulties or to indicate an interest in offering public comment. Exercise caution with links which may appear in any meeting chat, as they could be malicious. At this point, we'll move on to agenda item number 1, which is our call to order and roll call to establish quorum. Emma, can you?
Yes, Chelsea Cheatham. Dr. Dixon.
Here.
Senator Doniate. Attorney General Ford. Senator Severs Gansert. Assemblywoman Hardy. Shayla Holmes.
Present.
Jeffrey Iverson. Jeffrey Iverson, can you please indicate if you're present?
Present.
Thank you. Jessica Johnson.
Present.
Dorothy Edwards.
Present.
Nancy Lindler.
Present.
Debbie Nadler.
Present.
Angela Nichols. Christine Payson.
Present.
Eric Schoen.
I'm here. Good afternoon.
Steve Shell. Dr. Slamowitz.
Present.
Assemblywoman Thomas. All right, Dr. Kearns, we do have at least 10 members present. I counted 10 in the quorum, so we do have a quorum.
Okay, and obviously when Attorney General Ford gets here, we'll know, and if anyone else comes on, please let us know.
I just want to know, I'm going to call 2 additional people I see, Chelsea Cheatham.
Present.
And Steve Shell.
Present.
Great, thank you.
Okay, at this point, I just wanted to highlight on your agenda, item number 5, which is the update on the opioid litigation settlement funds and distribution, is going to be pushed down further in the agenda so that we have a couple of members who have to leave early. So we want to get the ranking and the annual report items done. So that will be taken out of order and will be after item number 9 as we go forward. At this point, we'll open the floor to public comment. Public comment will be received in person at either of the locations listed above and via the Zoom meeting. Public comment shall be limited to 3 minutes per person. This is a period devoted to comments by the general public, if any, and discussion of those comments. No action may be taken upon a matter raised during a period devoted to comments by the general public until the matter itself has been specifically included on an agenda as an item upon which action may be taken pursuant to NRS 241.020. Do we have any public comment? We'll start here in Vegas. There's no public comment in Vegas.
Dr. Kearns, Kelly Marshall for the
Yes.
record. Just a note, if you're dialing in from a telephone, please dial 719-359-4580. And when prompted, the webinar ID is 841-1615-6896. The meeting passcode is 676-835, and you can press *9 so we can prompt you to unmute. If you're joining
you.
your computer, you can raise your hand. So the host can then call on you and unmute you. And before commenting, please state your full name for the record.
Thank you, Kelly. At this point, I'd like to just highlight that AG Ford, our chair, is here, so he will be taking over the chair duties.
All right,
We're at public comment.
okay. So do we have any public comment? Okay. Now on screen, right?
No, I do not see any on the
Okay.
screen.
Hearing and seeing none, we'll move on then to agenda item number 3, although let me note that we are going to move agenda item number 5 to the end, so that we can proceed with some votes before people have to depart. Do we need to move that up right now? Or can I just go ahead and go to number 3?
Yeah, you can go to 3.
Okay, all right. Agenda item number 3 is a review and approval of the minutes from our October 11th, 2023 SURG meeting. They've been distributed. And I will entertain a motion to approve those or amend them if need be. Yes.
This is Jeff Iverson. I'll make a motion to approve.
Thanks, Jeff. Can I get a second?
This is Steve Shell for the record. I'll second.
Thanks, Steve. It's been moved and properly seconded that we approve the minutes from our October 11th meeting. Any discussion? Hearing and seeing none, all in favor, say aye. Aye.
Aye.
Aye.
Aye.
Any opposed, say nay. Motion carries unanimously. Thanks so much. We'll move on then to agenda item number 4, which is reappointment of some SURG members. With that, we have to reappoint one advocate for persons who have substance use disorder and family members of such persons. The suggestion is Debbie Nadler. One person who's in recovery from substance use disorder, and that would be Jeff Iverson. One person who provides services related to the treatment of substance use disorder, that's Nancy Lindler. One representative of a substance use disorder prevention coalition, Eric Schoen. One representative of a program to reduce the harm caused by substance misuse, Chelsea Cheatham. One representative of a hospital, that'd be Steve Shell, and one rep of a school district, that'd be Angela Nichols. And I just need to appoint them, right?
Mhm.
You are hereby appointed. Okay. Moving on, agenda item number 6, subcommittee reports and remanded recommendations. We will have Kelly read some slides for us.
Thank you, Chair. Kelly Marshall for the record.
Oh, you're in the wrong meeting. Okay, I'm sorry. Go ahead, Kelly.
All right, Kelly Marshall for the record. So subcommittee chairs and vice chairs are going to provide an overview of changes to recommendations that were remanded back to their subcommittees following the October SURG meeting. Please refer to the SURG combined recommendations dated December 2023. That was a handout that was provided to you and is also posted online for the full recommendations. SURG members are invited to ask questions and identify any recommendations they would like to revise or pull from consideration following each subcommittee report. So there will be 4 different subcommittee reports. At the end of each subcommittee report, you would identify if there was something you wanted to revise or pull from consideration, and you would vote on that once whatever revision had been worked on, and we would do that in real time. And then you would have the vote, and we would move on to the next subcommittee set of remanded recommendations. I would also note that you are once again being asked to prioritize your top 5 recommendations. So you have that SURG combined recommendations from December, but if something has changed and that changes your view of how you would prioritize it, I think it's helpful to follow along during the presentations and using that handout so that the polling process will work quickly and expeditiously.
All right, thanks, Kelly. The first subcommittee that we will, and incidentally, we are allotting certain minutes for these. The first one is the Harm Reduction Committee, Jessica Johnson, the Prevention Chair. We're allotting 8 minutes for this discussion, and so go ahead.
Wonderful. Thank you so much, everyone. Jessica Johnson for the record. So I'll be presenting the harm reduction remanded recommendations, and then my vice chair, Mr. Schoen, will be presenting the prevention remanded recommendations. So the first one I wanted to highlight here is for the harm reduction recommendation number 2. In our October meeting, we had requested a SURG member that was available to go through and really revise the language here. And a big thank you to Ms. Chelsea Cheatham, who volunteered and did just that. So the bolded language here indicates where the changes have been made. And in this case, the entire recommendation was reworded for simplicity and specification. This is around providing for shipping cost for evidence-based harm reduction supplies and the travel cost to pick up things like used sharp products to be returned for destruction. This is also an opportunity to increase information about shipping programs to residents of rural Nevada as a strategy to increase access to harm reduction items and products within rural and frontier parts of the state. And then additional opportunities for local harm reduction efforts and establishing an alternative strategy for harm reduction supply delivery if individuals can't receive delivery of supplies directly via mail. So a big thank you to Ms. Cheatham for increasing the specificity and clarity in this particular recommendation.
Okay.
In addition, she also worked to update the background and other sections that can be found in the longer recommendations document. So thank you on that front. Do you want me to take questions at the end? For the 8 minutes? Okay, terrific. With that, I'll move on to harm reduction recommendation number 4. This was remanded back to the subcommittee with a recommendation to be a little bit more specific and add additional specificity around what this recommendation entailed. So our committee reached out to the Network for Public Health Law to see if they had any additional resources or other states or communities that had approached such type of a recommendation, and they did. The Maine legislature made a similar type of recommendation around paraphernalia definition in 2021 to address overdose risk as it related to smoking and smoking supplies. So we were able to incorporate those additional changes. There's a lot of detail in the subsequent document on pages 33 to 35 that details out this proposed draft change to NRS 453.554 in the justification section that really specifies the specific recommendations around this paraphernalia definition. Next, this is as revised for harm reduction recommendation number 5. Those of you following along at home will recall that this was originally remanded to the treatment and recovery subcommittee to combine with another recommendation, and they opted to not do that and to continue with their recommendation as originally worded. Totally fine. Our subcommittee worked together to add additional language to keep both the CHW and peer recovery support specialists, or PRSS, as part of the team of outreach workers, noting really that both have been historically underfunded and therefore potentially underutilized in our state. Our Vice Chair Schoen made some additional enhancements to the justification, background, and qualitative elements following the presentation to really detail the importance of peers and how these two certifications can work together, and particularly in places like rural and frontier Nevada, but really across our state to help folks to expand access. That concludes my presentation of the remanded subcommittee items, and I am happy to take any questions or follow the direction of the SEI committee if there's anything additional that wasn't covered.
Yeah, let's go to questions. Are there any questions, concerns, comments, complaints about this? None coming up on the screen. Okay. So is the idea then we're gonna go to the next one and then in 7 we'll.
No, I
you
think
shaking
we
your
would,
head.
Kelly Marshall for the record, Chair Ford, I think what we would do then is actually adopt, so a motion to adopt the remanded recommendations for harm reduction. Because we
Okay.
can't be certain that there won't be additional changes on any of the other subcommittees.
Understood. Okay, per that instruction, then I will entertain a motion to adopt. Do I get a motion?
Can I make a motion?
You
This is
can.
Jessica. I'll
Yeah.
make a motion to adopt the harm reduction recommendations as revised.
There's a second.
Jeff Iverson.
My second.
Okay, we got plenty of seconds. I'll take Jeff. All right, so moving and properly seconded. Y'all know what I'm saying. Let's, any discussion on the motion? Hearing and seeing none, all in favor say aye. Aye.
Aye.
Aye.
Any opposed? Motion carries. Thanks so much, Jessica. Mr. Schoen, talk to us about prevention.
Okay.
We've
Good
also
afternoon.
allocated 8 minutes for you.
Yep. Thank you, Chair. Good afternoon, everybody. I'm happy to present these two revised recommendations. The first one, prevention subcommittee recommendation number 1. We were asked to provide additional specificity. So the specificity that we provided was doubling the amount of investment in SAPTA primary prevention programming. That is increased from current $12 million per year that's allocated to $24 million. Sorry, $12 million per biennium to $24 million for this biennium for ages 0 to 24 and review the funding allocations annually. This funding should not be done at the expense of existing programming. These numbers were based on hard numbers provided to us by the department of the amount of money that is allocated for primary prevention in both the general fund as well as from a block grant, which comes to $6 million annually, so $12 million biannually. That's currently. That's the recommendation is for $20 million to increase to $24 million biannually. We also provided additional justification and background on the cost effectiveness of this.
Very good.
And
Go
then
ahead.
and then our second recommendation was to also have more specificity. You'll see a theme here in these. Create a bill draft request to amend the NRS for 15% set aside of tobacco control and prevention funds from the Fund for a Healthy Nevada. This would be distributed using a local lead agency's model to reach $2 per capita, a recommended funding goal from the Nevada Tobacco Control and Smoke-Free Coalition and subject matter experts. So we provided additional language that includes the percentage to equate to 2% per capita, and additional information for justification stating that a 15% set aside of the approximate $41 million received annually for the state of Nevada would be about $6.15 million, which gets us close to the $2 per capita. Short and sweet.
All right, thanks, Mr. Schoen. Any questions on these recommendations? Y'all trying to make this quick. Okay, then I will entertain a motion to adopt the recommendations as revised.
Jeff Iverson, I will second that.
How about you be the movement?
I'm sorry, I'll make a
All right.
motion to approve, to adopt.
Very good. And Debbie is gonna second it. Okay. It's been
I,
moved and
yes.
properly- All right, thanks, Debbie. So moved and probably seconded that we adopt these recommendations. Any discussion on the motion? Hearing and seeing none, all in favor, say aye. Aye.
Aye.
Aye.
Any opposed, say nay. Motion carries. Thanks so much, Eric. All right, moving on to treatment and recovery, Mr. Shell. You
Thank
got 5
Chair
minutes.
Ford. Steve Shell for the record. This will also be a very short report for the Treatment and Recovery Subcommittee. So regarding our recommendation number 3, we are proposing to change opioid use disorder to substance use disorder. We felt that opioid use disorder was too limiting, and we feel like substance use disorder is a more broader context. So that is our proposal regarding that recommendation. Regarding our recommendation number 6, that was remanded back to us by the harm reduction committee, we felt very strongly that we should leave this recommendation as is. There's been a lot of work over the last several years about peer support specialist, and we felt strongly that this needed to be a standalone recommendation specific to peer support. And that concludes my report.
All right. Thanks, Steve. Questions, comments, concerns? Then I will entertain a motion to adopt these revised recommendations.
This is Steve Shell for the record. I make a motion that we approve these two recommendations with the changes as noted.
All right, we have a motion and then a second from Dr. Dixon. Any discussion on the motion? Hearing and seeing none, all in favor say aye. Aye.
Aye.
Aye.
Any opposed? Motion carries. Thanks so much. All right, Dr. Kearns, it says 10 minutes. I'm gonna give you 2. Response committee, go ahead, Dr.
I'll
Kearns.
try my hardest. For the response subcommittee, as you can see on the slide, the recommendation was that response recommendation number 1 be combined with the treatment and recovery recommendation number 2. So we looked at the language between the two, and the highlighted language is what we added to include the language that was in treatment and recovery recommendation number 2. So that is the change to this recommendation with the highlight that you see on the slide.
Okay.
Moving on to the next recommendation, recommendation number 2 was remanded back to provide more specificity. And the recommendation came up that the highlighted component is recommend that the Nevada System of Higher Education conduct a feasibility study, and the funding may be made available through the Fund for a Resilient Nevada to look at the feasibility of the wastewater-based epidemiology. And that was our recommendation change for response recommendation number 2. Moving on to response recommendation number 3. Again, this was remanded back for to try to combine 2 recommendations, being the response recommendation number 3, and then also the harm reduction recommendation number 3. So once again, you can see the highlighted or bolded language was what we added into this response recommendation to include the recommendation from harm reduction, their wording. So it was basically, we've added, and those impacted by the overdose, for example, other persons with a personal and or emotional connection to the victim, surviving family members, and or post-mortem services for families. So that was the change in response recommendation number 3. Moving on to the next was response recommendation number 4. This was about the overdose fatality review. And in our recommendation, we wanted to look at lessons learned from Clark County's overdose fatality review task force, which has been formed. Their first meeting is in February of 2024, which we've been in contact with them. So we were removing this recommendation from this year's annual report, and we'll follow it up looking at lessons learned from Clark County. So we will consider it again in 2024.
Okay.
Moving on to the next is the response recommendation number 5. And under this one, it was originally for a independent medical examiner. And there was a lot of discussion in terms of, was this just for prosecution or not? So we did have a presentation from Dr. Knight with the Washoe County Medical Examiner's Office. And she really highlighted the point that the mission of their office is to conduct an investigation and determine the cause of death. It's not for necessarily prosecution, but the consumers are, number one, to get the right cause of death for family and family members. then it can also support law enforcement for prosecution and for law enforcement purposes. But it also does support public health in that the information that they provide is they do provide that information to anyone who asks. So what Dr. Knight did recommend is that there be a compliance study on NRS 259.050, number 3, which is, I have it here so everyone knows, that is that it's investigations into cause of death, postmortem examinations, inquest. 3 is if it is appropriate to or can be reasonably inferred by the coroner that a death may have been caused by drug use or poisoning, the coroner shall cause a postmortem examination to be performed on the decedent by a forensic pathologist unless the death occurred following a hospitalization stay of 24 hours or more. And she said that was important because the Washoe County Medical Examiner's Office does do those examinations for the majority of the counties, and the Clark County Coroner's Office does it for Clark County, I believe Lincoln County, and also Nye County. So her thought was that we need to see if those are actually being referred for the examination by a forensic pathologist. And then NRS 259.053 is post-mortem examinations by forensic pathologists, determination of cause of death, death certificate. If a forensic pathologist performs a post-mortem examination on a body under the jurisdiction of the coroner, the forensic pathologist shall determine the cause of death of decedent, and the certifier of death shall record on the death certificate the exact cause of death as determined by the forensic pathologist. So her thought was we need to look back. It was put into NRS in 2019 to see if it is being done. So her recommendation was this compliance study that be done. And then her other recommendation was she really doesn't just need the independent medical examiner, but her office needs and death scene investigators, forensic pathologists. She really highlighted a forensic epidemiologist because she said that could really assist with getting the information together and report it out in a more timely manner. And then the toxicology testing, she did say that she does get some funding from the Overdose Data to Action. I believe she said it was about $30,000, and then her office pays for the rest of the toxicology testing. They do not do the testing. It gets sent out to an independent lab who does the majority of the toxicology testing. She said that they are on pace to probably spend about $500,000 this year for that toxicology testing. So that based on Dr. Knight's recommendations, we did reach out to Clark County Coroner's Office, but did not get a response from them. So based on the input from Dr. Knight, we revised these 2 recommendations into response 5A for the compliance study, and then response 5B about providing additional or adequate funding for the medical examiner's office to include these positions that she spoke about. The last thing under the response subcommittee was these recommendations have been provided to that joint cross-sector advisory task force. That was about the recommendation to resolve the conflict between the Good Samaritan law and the drug-induced homicide law. And for the joint advisory task force to look at that for public health messaging, best practices to educate the public on the Good Samaritan law, and then also create targeted messaging for people who use drugs, and also to include education and training for law enforcement on the Good Samaritan Drug Overdose Act. And then another one that was pushed forward to the Joint Advisory Task Force was to optimize available data, inform actions, and update the community response plans. If the task force doesn't take this up, the response subcommittee will look at that again. And that concludes the response recommendations. If there's any questions or discussion, I'm happy to take that.
That took longer than 2 minutes, but that's okay. The compliance study, who do they suggest do it?
Crystal, do you remember, did she respond with an agency that would do that? Would that be like LCB, or who would that be?
I don't think that Dr. Knight mentioned an entity that would do that.
Okay.
We'll reach out to her and see what her recommendation is.
And then the money for the positions, would that'd be a county expense though, right?
For her, it would be a county expense, but because she does do those examinations for the other counties, she does get funding
Okay.
from them. They do pay for her to do those. So
Okay, but is there a request that the state provide additional funds for
I
those
think she
positions?
was looking at that, whether that be from the Fund for Arizona,
Yeah,
Nevada,
okay.
or some other.
Okay, all right. Other questions? Yes, ma'am.
Hi,
Yes.
Jessica Johnson for the record. With regard to the compliance study, did Dr. Knight suggest anything sort of specifically what the scope of that would be? Can you say any more about?
All she said was that was put into NRS in 2019, that the counties are to make sure they send their cases if they suspect there's been substance use. And then also that on the death certificate, it is the cause of death from the forensic pathologist, but she says we don't know what the status of it is, was all she said. So that was why she suggested the compliance study, to see if it is indeed being done.
Wonderful. Sorry, one more follow-up question. Will that include any of the scope of, so one of my understandings is that from what I heard you say and from the coroner's office, that the amount that's received from ODTA is also capped by that particular grant. Will that include if there's any limited availability for sending out for additional follow-up testing because of cost?
She didn't seem to think cost was an issue, because like I said, she said she got a minimal amount, but her office was poised to pay that additional $500,000, but that is at the expense of the taxpayers.
Correct. Okay.
So,
Yeah, it does sound like it may be an LCB compliance type study to see if the NRS has been complied with. And so, but yeah, follow up and let's figure out if that's what
Yes.
she was thinking.
certainly.
Okay. Other questions on the response report? All right, then I will entertain a motion to accept these revised recommendations.
So
This is Shayla
Debbie.
Holmes. I make a motion.
All right, who was that up north that said that?
Shayla Holmes.
All right, Shayla Holmes has made the motion, and Debbie, I'll take your comments as a second, okay?
Yes, sir. Thank you.
All right, it's moved and probably seconded that we accept these revised recommendations. Any further discussion on these? You can see none, all in favor, say aye. Aye.
Aye.
Aye.
Any opposed, say nay. Motion carries unanimously. Okay, so we need to give staff 5 minutes to update recommendations before we begin the ranking process. And so why don't we do that? Take a 5-minute break. I see a thumbs up from somebody.
We're good, Carson.
All right, we're good. Okay, then let's move to agenda item number 7, a review of the Slido process and complete ranking exercise for prioritization of SURG recommendations. We've allotted 20 minutes for this. Crystal, go ahead.
Thank you, Attorney General Ford. This is Crystal Duarte for the record. So this process may be new for members who were not able to attend in October. I'm going to go through all of the instructions for ranking on Slido before we show how you will actually do that. Results of the preliminary ranking that were done in October are available and were sent as a handout that shows how each member ranked the recommendations as well as the total score for a recommendation. That is available along with the meeting materials, and we will do the same thing for this meeting as well. The results will also appear in the annual report. You'll have an opportunity to rank all of the recommendations. So in the presentations that you just heard, we only heard about remanded recommendations, but in the Slido poll, you will see all of the recommendations that the SURG will be putting forward. Recommendations that were remanded begin with an asterisk, so you can see those ones that changed. Slido has a character limit, so you will not see the entire description of the recommendation in the poll. To see more detail, please refer to the handout, SURG Combined Recommendations, December 2023. recommendations that have been shortened end in an ellipsis. So if you wonder what is included in that recommendation, you may want to refer to that other handout. The ranking process is available to SURG members only. If you are a member of the public, please do not vote when you see the information on the screen, as all members will have to re-vote if you do that. You can vote via smartphone or laptop, and you'll be able to select your top 5 recommendations. So in just a minute on the screen, you're going to see a QR code, and you can scan that with your phone. You can also go to slido.com and enter the number 1839782 when prompted. You may be asked to enter your name and agree to the terms. The reason for that is with that information, we can publish the rankings and how each member ranked. So you'll be able to select your top 5 recommendations. You do that by clicking the recommendation that you would like, and it'll appear at the top of the list. If, when you go to look at, before you submit your recommendations, you want to switch the numbers or the order in which you have things, you can do that by just sort of selecting it and moving it to the top or the bottom. Please be sure that you review your selection before hitting submit. We can't really redo the poll. And you will notice that response recommendation 5A and B are a combined recommendation. So that was the last one that Dr. Kearns discussed. And we will again share their results as an Excel export after a brief break. So we will be taking another break after this poll so that we can review those and present them back to you. If you have any questions, please raise your hand. You are able to chat for technical support on this item, and staff will be able to respond to that.
No.
Okay. It's not coming up. We're getting, Crystal, it's not coming up. We're getting like a Q&A field. And when you go to polls, it says there's no current polls.
Okay.
Oh, did you? Let me try again.
I think I fixed that now.
Okay, I got it.
So how do I do this without a QR code? When she
Oh.
she said it, but I forget what she
It's
said.
no problem. So go to
Slido.
slido.com.
All right, let's see if I can find that.
I see Ms. Nadler has her hand raised.
Yeah, go ahead, Debbie.
Sorry, I
Debbie, you
couldn't
got a
find
question?
unmute. Yeah, I do. So I'm in there right now, but you know what? It just popped up. It didn't have the questions. So just again, to reiterate, I'm sorry. I just clicked. We click on 5. That's it?
Yes, select your top 5.
Okay. Thank you.
Does anyone know what the password is?
Yeah, do you want me to bring my computer over and you can just do it on my computer?
That would be wonderful.
And we
My
only
phone
get
is-
5, right?
You only get
That's
You
5.
only
correct.
get 5. If I understand correctly, all
Yeah.
recommendations will appear in the final report.
I know,
It's just the order in which they were.
There's too many good ones on here. I can't limit it to just 5.
I have the same problem, Eric.
13 members present who submitted the poll. There's no rush. Oh, now it's 8. But I did want to note that we will be waiting until we receive all votes before we move on to the break to work on the ranking. If for some reason you're abstaining, please let us know.
Sorry, it's Debbie Nadler. I'm almost done. I'm just figuring this out here. There's too many. Hang on.
All good. Take your time. We're good.
I sent it already, but now do I need to rank them? Is that why y'all haven't gotten them?
I showed 12 people have voted. The whole process shouldn't really allow you to hit submit until you rank them unless you just selected 5.
Oh, so if someone selects just 5 and send them, then that's it?
That's
That's
it.
all we need to do.
Okay. Thank you.
I think there's 13 in.
Success.
Okay. Does that mean we're done? Everybody has
Let me
voted?
just double check. I only show 12, so I'm refreshing to make sure. I do have 13 now.
And one is anonymous.
I can't see that yet, but I'll replace it if that's the case. Yes, Chair Ford, I do show 13 votes, so we can now take a break so that we can export the results of that poll.
All right, let's take, you say you need 10 minutes? Is that what I'm saying?
Yes.
Okay, all right,
Yes,
we'll be
please.
back at 3:04. All right, I think we are ready to proceed to agenda item number 8, which is to review the ranking results to include in the annual report. Note that there would not be additional opportunities for subcommittees to meet and discuss these recommendations. Staff's gonna update the annual report recommendations section based on these results and related discussions and/or action. So let's go ahead and review them.
Thank you, Chair Ford. You should see those on your screen now, and it is a bit hard to see. Let me see if I can get that any bigger. So now you see the results in the order of the highest ranked recommendation all the way down to the lowest ranked recommendation, and I can scroll anywhere you would like in the document. I did want to note that we have 3 recommendations at the bottom that received 0 votes. And so the committee may want to decide what to do with those 3 recommendations in terms of whether or not they should be included in the report this year or not.
Scroll down.
I have a question. With the combination and the reworking of the recommendations, how many total recommendations were there? Was it like
We have
7?
20
Oh,
recommendations.
okay, thank you.
Okay. All right, let's go back up to the top, please. Okay, comments, discussion on this? Specifically to those last 3 that had 0 votes, it is worth a discussion on whether we include those at this juncture. I mean, these were some of them that got sent back to subcommittee, the NSHE study, for example. Thoughts on including or excluding?
Yeah, Chairman, Eric Schoen for the record. Somebody who served on the prevention subcommittee, I would love a reference to be included for prevention recommendation number 3. I think it's an innovative tool that has not yet been utilized. It could potentially help down the road, even if it just gets a shout out in the report. I think that would be helpful.
You know, I think you raised a good point, and I think, I mean, I'm not making the decision, but I do think you're right. We can say other ideas suggested or discussed during meetings include maybe those last 3 without a discussion on how many votes they did not get. Make sense?
I like it.
Okay. 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 there's really no action item here, right? I mean, well, I guess there is. I need to accept a motion to include those top 5 there into the annual report unless someone has a vehement objection that needs to be voiced. The vote is the vote. Anybody want to recount?
I'll make a motion.
Okay. Who made the motion?
Jeff Iverson.
Oh, Jeff, so you're moving to include the top 5 into the annual report, is that right?
Yes, sir.
I
Is that the
think it's
motion?
all of them.
Yes,
Okay, talk to me.
that's correct.
Okay.
Sorry,
It's all of,
Chair,
go ahead,
Chair
Laura.
Ford, so each member could vote for their top 5, but then it's cumulatively looking at everything. And so we just, because those last 3 didn't get any votes, we didn't know if you wanted to include those. So that's the,
Oh, I
we would
understand.
include all of them, and it's up to you whether or not you want to include those last 3 that didn't get any votes. But if you include one, you should include them all because they all had a 0 ranking, if that makes sense.
Yeah, so my apologies about the confusion there. So the motion would be to include, so the only motion we need is include the bottom 3 as an honorable mention. Is that right?
To accept them as they are ranked and
Yeah.
include them in the annual report, and then what to do about the bottom 3.
Jeff Iverson for the record. I liked the idea of mentioning them as discussed suggestions, but that they didn't make it into the top 20. Or, you know what I mean?
17,
Yeah.
top 17. Yeah.
Top 17.
Okay. So that's the motion. Eric, you want a second or you got a comment? to make?
I would second that.
Okay,
Eric Schoen, I would second that, yes.
moved and properly seconded. Further discussion on this? Okay, do you need any further instruction? Anybody? Okay, very well. All in favor say aye.
Right.
Aye. Any opposed? Motion carries. Thanks so much. Okay, that was a 30-minute discussion we just had. Okay. Feels like I'm doing something wrong. I'm not holding y'all long enough. Okay, let's move on to number 9. Review draft annual report. We've allotted 15 minutes, but I will let you go over a little bit. How about that? Laura Hale.
Okay, thank you. So we got so much great content in the work, from the work of the subcommittees, with not just the recommendations, but all the references and the justifications. And so that is really going to be the bulk of the report this time around, but there is a high-level executive summary that Kelly's moving down to on the screen. And that just kind of really focuses the different subcommittees that we had putting together this and this work. The recommendations that are in there now will be updated with what you just voted in the order of those priorities, but you can see it just kind of pops, and it's a very clean format there, so that it will be very legible for our readers. And so then moving down to the methodology, we just updated that with the changes that occurred over this last year. We noted the fact that legislators were excused during the legislative session. We identified our chairs and vice chairs and really called out the excellent work and the dedication of all of those folks and all of the members bringing their expertise, skills, commitments as being essential to the success of the SURG. And then we noted that we had a separate listing of harm reduction after we got the presentation that was to the full SURG last spring, and that then went under the prevention subcommittee. And I don't have the.
I'm sorry to interrupt, but we lost the report and it went back to agenda item number 9 on the PowerPoint. So we just need there. Thank you.
Thanks, Kelly. So then the other information there is just, the support from the Attorney General's office and staff and the different things that work to bring all of this together. And we also went through why we came up with this ranking process based on members wanting to do that. This next section will be the recommendations, and you'll have their justifications in there with their action steps. Everything else in the report, so basically this whole large document that was created with the recommendations, justifications, et cetera, will be the main body of the report. Everything else is going to go into the appendix. So we'll have research links there. Target population impacted will be there. Appendix C, legislation that's addressed. Appendix D. We wanted to include an update on the 2022 recommendations that the SURG made and what the current status is. So we'll go back through, we'll work with the HHS to get updates on that. And then there will be a link under Appendix E that basically directs you back to the AG's website and the SURG describing the membership bylaws, the meeting materials, all of that will just be a link. And then Appendix Item F is information regarding opioid settlement funds, not just for Nevada, but this is a link that Dr. Kearns actually provided that is a nationwide thing that looks at all of the states, and it's a high-level profile for what each state is doing, and it's a great link for not only the public, but our members as well to be able to see that information. And basically that is the extent of the report. There's some more detail, but we will update it based on what you did today. And we'll have that back to you in January. So unless people have any questions or concerns about the general format of that, that's all we have.
This is great. Thank you for this fantastic work and this fantastic draft. I will note that we'll have to fix the cover page. I don't think it's called the Advisory Commission on the Administration of Justice anymore, to whom we're submitting this. I think they've changed the name of these subcommittees now. I think it's just the Interim Joint Judiciary Committee or something like that. So let's just, we'll confirm where these are going, but I did note that on the first page here. But other comments, in my mind, we're going to have a meeting in January to adopt this before January 31st, which is the date on the report. And we'll get this in advance of the meeting so folks can have read it, and we'll be able to come in and have a vote on it with full knowledge of what's contained in the report. But other comments right now?
This is Shayla Holmes for the record. I would just encourage perhaps when the final report is done, how the recommendations or the draft recommendations are on page 1, and then the ranked recommendations will be later on, or will that be changed? Because I just have concerns that if we list them in 2 different ways, that depending on how an individual peruses this document, they may or may not identify the weighted or ranked ones.
AG, if I may.
I hear what you're saying. Go ahead, I'm sorry.
The intent is that under the executive summary, those will be the final ranked recommendations, but just abbreviated. It won't have all of the detail that will come later in the body. So it's just that high level executive summary.
Okay.
But they will be exactly the same ranked order.
As it shows later on in the document.
Yes.
Okay.
Sorry about that.
Thank you so much. I appreciate the clarification.
And then I have a question.
Yes.
Yeah, Chairman, maybe I'm getting ahead of myself a little bit, but once this report is completed, how will we share it out?
Well, I think a few ways. It'll be on our website to be sure. And I could probably issue like a press release and attach it that way. It's going to be distributed to the governor and to the legislature. But I'm also open to other suggestions. I mean, if you think you want to make it a more widespread distribution, I mean, I think we can discuss that. I mean, I don't have a problem with that.
I think that would be an interesting discussion. I don't know if you've agendized this properly to dive into that today, but I think that would be an interesting discussion because there's a lot of work that goes into prioritizing this, and it would be nice to see it get utilized or at least considered as part of the decision-making process for what happens in the future with our resources and different bill drafts.
You know, it's a great point, and I think we could certainly amplify this a lot more than we did last go around. Not because, you know, we just didn't think about what I'm about to say out loud.
Yep.
And we can't make a decision today. I know it's not on the agenda, but we could do a press conference, like the committee itself, where we present this. You know, we can't spend a whole hour presenting it, but you know, invite press out, talk about this, talk about the work we've been doing over the last, at that point, 4 years on something like this, and then try to share it that way too. So I mean, I'm happy to consider maybe I don't know. Do we need to agendize that to have a discussion on something like that?
Sure. Yeah, I mean, there's a item coming up talking about items for next meeting.
Okay, very good. Yeah, so next meeting, well, why don't we look into something like that? So come with ideas on other ways to amplify it, right? We can do it up north, down south.
Yep.
Wherever. Okay.
Perfect.
Other questions? No, I must say, we spent a lot of time in this room together, and it's a lot of hefty work, but this has to be one of the easiest committees for me to chair, because y'all do so much great work, and I don't have to know everything, because y'all know it all. So I just want to commend the committee for the work you put in on this. It really shows in the work product at the end of the day. So, you know, kudos.
I think we want to take a motion on approval of that format for the annual report.
Okay, this was for possible action, and so the motion I would like to entertain is to approve the format as presented for the annual report, as amended per our discussions. Yeah.
I'll motion. This is Debbie Nadler. I'll motion to accept it.
All right, Debbie has moved. Could I get a second?
This is Jessica Johnson. I'll second.
Jessica Johnson has seconded that. Any discussion on the motion? Hearing and seeing none, all in favor say aye. Aye.
Aye.
Any opposed say nay. Motion carries. Thanks, and good work again on this. This is good stuff. Okay, agenda item number 10, review and consider items for the next meeting. I think we have one. I'm sorry, did I miss something?
Item 5.
Yeah, item 5.
Oh, yeah, my bad.
Yeah.
My bad. Let's go back to, did we get Mark? Mark, are you around, buddy? Yeah, I see you, Mark. Can you hear us? I can text him. I think we could probably do, we can go ahead and do number 10. I'll come back to 5.
I'm here.
So let's talk about
General,
other. Oh, yeah, I'm ready. Yeah, yes, sir. We're ready for you.
All right. Thank you. Hi, everyone. It's nice to see everybody. Mark Kruger for the record, Chief Deputy Attorney General with the Nevada Attorney General's Office, Bureau of Consumer Protection. The update on the opioid litigation settlement funds and distribution is actually not so much focused on recoveries that we've received, as I pretty much kept you guys updated on that. But it has transitioned into 2 areas. One is reports that will become due after January 1. We've sent out documentation to all of the counties, cities, all of the signatories to the One Nevada Agreement, requesting that they submit the reports of the use of the opioid funds. I know that this is also nationally getting some attention because people are starting to ask for, what kind of programs and services are being funded. So when we receive that information, DHHS will compile it. DHHS is actually the point that receives all the information. But I am pleased to let you all know, too, that we've been working with our IT department internally in the Attorney General's office, who is trying to build a reporting program, like a cloud-based reporting program, so that instead of receiving all this information through an actual document, it can all be uploaded throughout the year continuously as funds are spent by the signatories to One Nevada Agreement. That may take another couple of months to get into place. DHHS will have kind of access and control over that report. So that's primarily the area that we're going in. So I'm kind of pleased about how that's progressing. And the last piece of it is We should be, we've been having our recoveries coming in, and we've been distributing them as they come in, and that's been going fairly smoothly. So you should see a lot of the programs and services from the counties and the cities, the signatories to One Nevada Agreement, start being set up now, and funding starting to flow to actually address the opioids epidemic. And I know that DHHS has already done quite a few grants as well. They've done some NOFOs, and they're starting to fund services and programs as well. So things are progressing, and that is my report, General.
Hey, listen, Mark, I appreciate that. I want to clarify, because there still remains confusion out there in the media and elsewhere, frankly, with some hit pieces coming out on ways in which money has been spent, who makes those decisions, and this, that, and the other, just being perfectly frank and candid. I want to ensure that we understand that your use of the word distributing funds, you're talking about monies that we get in pursuant to our settlement agreements that we distribute to the counties and that we distribute to DHHS, not that we're distributing funds to organizations or entities or figuring out ways to spend the money.
That's correct. When I use the term distributing or dispersing funds, it means the funds that we've received in through settlement agreements or the bankruptcy courts. And those funds are then dispersed to the signatories of the One Nevada Agreement. Then the actual use of the funds is at the discretion of the Department of Health and Human Services for the state portion of those funds, or for each of those signatories portion of those funds. So that they're the ones who actually make the decision on how to use it. And as you guys know, one of the purpose of the ACORN as well as the SURG is to provide recommendations, which you all did, to DHHS to create the state needs assessment and plan, which then prioritizes what funds are going to be funded by those state dollars by the Department of Health and Human Services at their sole discretion. It has nothing to do with the Attorney General's office making those decisions on what's being funded as far as programs and services. We simply bring the money in and disperse it to the signatories for them to spend it, as well as the state to spend. I hope that clears it up.
It does, and it should also be reiterated that the SURG committee makes no decisions on how that money is spent. It's not just AG's office, nor does the SURG committee make any decisions on how the money is spent, nor does ACORN even. I mean, they just make recommendations.
So my question is, how do we find out what DHHS has done?
DHHS has a website that details some of the things that they're doing in that regard.
Okay. Where is the regular website that I go to all the time?
Yeah,
General,
I
can provide some information on that. If you Google a fund for resilient Nevada, that will bring you to the DHHS website that contains several important pieces of information. One, it contains the documents from each settlement or bankruptcy court order confirming that bankruptcy on what the appropriate use of funds are. So those are very important pieces of information, because DHHS is further restricted not only by the state plan, but also by those settlement agreements and court orders. The other thing it will include is reports. Now, I will tell you there is a lag on reporting, right? Because the reports come in on a yearly basis. Well, that's why we're working to try to get DHHS some assistance to get a kind of a cloud-based reporting system, which might improve timing on that. But their reports are on that website, and they are statutorily obligated to create those reports because they are statutorily the only agency with authority to spend the money for the state.
We're starting with the website. Is that what we're doing to find this information? Is that what you said, the DHHS website?
A Fund for Resilient Nevada is the website, and I can Google that as well.
Which is housed within DHHS.
Yeah. Okay. All right.
Terry.
Yeah, Terry Kearns for the record. Additionally, Dawn Yohe is scheduled. She was going to report out to us in this meeting. However, as Mr. Kruger noted, she is not getting the reports from all of the other signatories until January. So she will probably come in our spring meeting and report out to us on the spending.
That's great.
From both DHHS and then from the signatories based on those reports that have to be reported back to DHHS.
Yeah, that's I mean, that's an interesting dilemma, right? I mean, because I suspect the counties, I'm guessing, but I suspect the counties may have their own website or reporting process where you can get information about them as well. So anyone who wants to know like the cumulative distribution to programs, they have to wait like a long time if they want it from one entity, i.e. DHHS, because they report on a yearly basis. And so this conversation, and kudos to Mark and my IT team for coming up with the way that my office at a minimum could make a cloud-based reporting opportunity available and a searchable opportunity for folks who want to know the monies that we receive in. But monies that's expended, you know, that's beyond our control as an office, but also I think a work in progress from DHHS and probably the municipalities as well.
Yes, in general, Mark Kruger again for the record, to add to that, we're hoping that cloud-based program can also incorporate the expending by the signatories to One Nevada agreement. That's our ultimate goal. If we can make it as transparent as possible so that people and as quick as possible so people can see where that spending is going, that would be really fantastic. So that's our goal. We're in the process.
Doctor, other questions?
No, I just would like to see what money has been spent so far and on what, because people like me in the treatment facilities, we are not seeing any money. And I was gonna, in public comment, gonna make some comments about that problem.
Yeah, I don't, check with the DHHS website that he's talking about to see if there are any centers that have received money. I don't know. I don't monitor it. I don't check in on it, but that's a place to start for now. And we can kind of continue the conversation as well. But we lost somebody. Okay.
And the information on that website, General, is in the chat. Joan Waldock throw it in there. Thank you, Joan.
Let me write that down.
I'll write it down for you, Doctor.
Yeah, let's read it out loud because the chat is not part of the public record.
Okay.
So
Chair Ford,
yes.
the screen share currently should have a website at the bottom. I amended it to include that.
Thank you. You read my mind. That is part of the public record right there. So you go ahead. At the bottom down there, there's a website where you can go and look at how money's been spent so far.
Is that what it says right there?
Yes, ma'am. Program/FRN.
FRN. Oh, that's regional Nevada. Okay, home.
Mark, anything else in your report?
No, General, that's my report. And if you guys have any questions, especially on the spending of the money and for programs and services, I do also recommend what Terry Kearns had said is that you can reach out to Dawn Yohe. She's very responsive and, you know, get pretty much any piece of information from her. She's in charge of this program over there at DHHS and is doing a great job.
Fantastic. Okay, any questions of Mark? Mark, thanks for hanging around, man. Appreciate your report, buddy. Have a good afternoon.
You got it. Thanks, everyone.
Okay, next agenda item is the review and consider items for next agenda meeting, for our next meeting. And so throw out some suggestions. Anything anybody want to talk about next time?
Currently, I'll put that we have these items agendized for the next meeting, which is currently put on your calendars for January 10th. It says 2023, it should be 2024. It's, first of all, we will approve the annual report today with the ranking of our recommendations. After that, we have the selection of a vice chair. If you will remember, Lisa Lee had been elected as our vice chair, but she stepped down from the SURG because she left her position that she was in that allowed her the membership. So we will be selecting a new vice chair. We have our proposed 2024 subcommittee membership meeting schedule and process. A quick update on bylaws attendance policy. presentation that we were previously scheduled to have, but couldn't coordinate schedules for the proposed equity lens from the Office of Minority Health and Equity. And as always, Mark Kruger providing our update on the opioid litigation settlement funds and distribution. And then I also heard the recommendation to have on the next agenda a way that we can distribute our annual report for 2023.
I'd also like to add, I sit on the advisory council for prosecutors, and they are requesting more than an ex officio membership on the committee. So I think we should agendize a question of whether we want to go to the legislature and ask for an amendment to our authorizing statute to add additional members to this committee, official members. Any other ideas or requests?
General, this is Dorothy Edwards. I am new to the team, so forgive me if I've missed some things or some of the process, but I'm wondering, as we, which I can't believe, as we move towards our next session, do we make any allowances on our agendas for discussion of either potential legislature? I don't know that this group gets a BDR, but we certainly have other groups that do get BDRs. Do we have a legislative committee, or is that something that we begin to talk about, you know, what we want to support or that sort of thing? I was just curious.
Yeah, no, thanks, Dorothy. It's a good question. We do have discussions toward the end of next year, because the session is going to be in 25, where even with some of the recommendations that have come out this go around, and they will be in an annual report, where we see if some of those can be put into a BDR request. We don't have any for this committee, but I've allocated at least one from my own stash as Attorney General to request. But we have 4 legislators on here, and some of them oftentimes will take some of the ideas as well. So at least from our perspective, the things that we want to be promulgated from our perspective, we have outlets in that regard. But I think you had a more refined question than that, which is other like legislation that's pending out there that we may want to support. And I don't think we've quite refined ourselves to do something like that. Part of it is probably because those things are kind of confidential until the session starts. Sure. What happens, generally speaking, is legislators get a number of BDRs, and then they confidentially request the details to be contemplated, and then until the draft comes out, you don't know what it is unless the legislator is telling you what it is. And so to the extent you know about information like that, you can bring it to us, or they can come talk to us about it, and we can see if it's worthy of our support. But I don't think we have otherwise refined our committee to do anything like that.
If I may add too, this is Terry Kearns for the record. If we are aware of other committees or groups that are bringing forth BDRs that were aligned with one of our recommendations, what we have done in the past is added our support to those, such as the policy boards. I know there were some on community health workers and those. So we just basically made a statement that this was our recommendation and supported them in moving their BDRs forward as well.
And I appreciate that. As the Washoe Regional Behavioral Health Policy Board, of course, we do get a BDR, and then I work within HSA as a legislative liaison. And so, of course, we are generally neutral, but our policy board, we ask for support on certain things. So I will just commit to, keeping my eye on that. And then as we move forward, if there's certain things that come up, I can bring them forward. I'm sure there's other more learned people in that than I, but I think if we do it together, we'll be able to handle it.
Well, one of the things that I can commit to as chair of this committee is and I would bring it to the committee before doing something like this, but if during the session we hear about bills that we like, you all want me to go up on behalf of the committee and testify in support of a bill, we can do that. I have a legislative team that works, TBT runs it up, Teresa Benitez Thompson runs it, and we could certainly have folks representing this committee testify in support of those bills on behalf of the committee. So keep that in mind too. Other questions, comments, suggestions for the next meeting? Okay. All right, then, I'm gonna move on to agenda item number 11, public comment. We shall limit it to 3 minutes per person. Members of the public may comment on any matter that is not specifically included on the agenda at this time. However, no action may be taken upon a matter raised under this item on the agenda until the matter has itself been specifically included on an agenda as an item upon which action may be taken pursuant to the NRS. With that, is there anyone who wants to speak on public comment? Yes, ma'am. Go ahead, Dr.
Yes,
Dixon.
Dr. Dixon, for the record, this kind of follows why we push from the treatment committee so much on the expanding access to MAT and treatment for SUD. And where is there money? Because today I was talking with our clinic director, and there's a lot of complaints about there aren't resources, or they don't know where to refer. And yet, meanwhile, I'm sitting there with no patients today, and something is going wrong here, and we're not exactly sure what all of it is. But one of the problems is money, and we have to charge patients to see them. And so a lot of our patients are on Medicaid. So we have two problems. We have and a lot of patients don't have any money, any way to pay. And so two problems. One is Medicaid. And I don't know what anybody can do about this, but these managed Medicaid companies put an enormous amount of barriers in the way of getting treatment, paying for treatment. They really make us jump through these hoops to get prior authorization. You never know when they're going to require it and not. These are old medications, Suboxone, buprenorphine. We've been using it for over 20 years now, and they still want prior authorization sometimes. And the newer forms that really work well, they want prior authorization. And when you have a patient in the office, you don't need to spend a lot of time on paperwork. You need to get them to the treatment. And so that's one of our problems. And then the other is that we have, like I said, a lot of patients that don't have any funds. They're not on Medicaid. They don't have whatever. And so we have a grant from the feds will help pay for people until they can get funding. But the feds, for some reason, haven't sent the money for several months. And so the money has to come in, and we're just sitting there waiting for money, and we can't put our patients on a grant that the money doesn't exist. So we're turning away potential patients too. And I don't know how what more can be done here, if we have any power here, but this expanding access to MAT is hard to have happened because the money is getting in the way, the funding. So I just wanted to bring that out so people understand what the real problems are.
Well,
and when people call, they get our front desk person, and then we'll tell them, and then they get turned off because they know they don't have the cash to come in and see us. So excuse me.
No, look, that's thank you for your public comment on that. I think you can follow up with Terry, maybe. And that can be dealt with elsewhere. Okay, next. Anybody else in public comment?
Yes, Chair Ford, we had a technical issue with the Slido. Apparently, all but 2 of the poll responses came in as anonymous. So I don't know if people weren't putting their names on them, and it comes in separate files. That's why we didn't see it earlier. But if members could all go back and identify what top 5 recommendations you made so that we will have that for the record. And I think submit them to staff. I don't know if that's to Crystal. If you don't have Crystal's email, submitted to Emma or whoever's email you have, because we need that for the record, because that will be part of what we provide in January. It's the Slido app creates multiple files when you do this, and we were just looking at the result file and not the detail, but that is detail we need, and I'm not sure why that happened. If people didn't put their names, that would be a reason, but we only have 2 people identified.
I am looking at my counsel to see if that's cool.
I think it will be as long as it works out. If people don't remember what 5 they picked, and then the results don't match up with what is here.
Yeah, I can't figure it all out. I'm too far.
Go ahead, Eric.
Yeah, there was no prompt when I signed in to put my name, and I just went in and realized that there was no name attached to it. So I just input my name for the profile. So I'm wondering if you pull it up now, if you'd see my name. That might be the easier fix.
I'll check. Oh, sorry, this is Crystal Duarte for the record. I can check on that.
Hey, I'm sorry, let me stop you for a second, everybody. Let me stop because we are on the agenda. I have a public comment. And this needs to, so I'm going to go back to agenda item 7 and 8 and consider this discussion part of those topics. So is that okay? I'm looking at my council. All right, council said it's cool. So go ahead, keep going, y'all.
So if members can go in now and put their names onto whatever they forwarded, then Crystal will get it. But if you're not able to do that, then you should try to make a list and send that to Crystal via email.
Something that Shayla noted, who's sitting here in Carson, is that at the bottom, it said that you could vote anonymously or you could switch it to your name. But I don't think any changes that you're making now are being reflected. So Eric, if you changed yours to show your name, or Shayla, if you did that, I'm not seeing any changes to my exports. So I think the option that Laura noted to send us your ranking, or we could open the poll again. I can clear the results. We can open the poll again and do it again.
If people don't remember, then you're going to have split.
You're sure you have to have a name tied to it? You can ask legal, and that's legal.
So the reason that we have names is because we want this to be a transparent process under the open meeting law. So we want to have that transparency when we report out as part of the record that we post and publish to the AG's website.
So listen, I think unfortunately we have to reopen the poll and do it again. I'm just concerned because I mean, some aren't gonna remember what they said and we just got to redo it, y'all. Fingers crossed that we get close to exactly the same results. But if not, we need to reopen that and vote again on these rankings. So, okay, can you put back up the Slido? And we will reopen the poll and go from there. And please, folks, put your names on there this time.
Hey,
Let me just
Crystal,
delete.
This is Dorothy Edwards. I think I had texted you. I was able to put my name, but when it came to the email, it just simply kept telling me my county email and also my personal email was invalid, which is why I had to put anonymous. It wouldn't let me just go with my name. So I don't know if anyone else had that problem. I will try again, but I absolutely put my name in, but it wouldn't take my email. So heads up.
Okay, thank you for that. It does look like the poll has been cleared and reopened. And I would just note that if you don't have to enter your email before starting the poll, please look at the bottom of the poll and see if you can change your name there to where it says voting as anonymous or voting as your name.
And I didn't have to put anything other than my name.
Yeah, and Shayla's noting that she did not have to put anything other than her name to change that. So it did not require an email to do it that way.
So click on where it says anonymous and type in
Oh, shit, it was cleared out. Oh, damn it, let me cleared it out once I started it.
We now have 13 results in, so I believe I can export results. I will check both exports to make sure we have what we need.
Okay, go ahead. Thank you.
We ready, Attorney General Ford?
Okay.
All right, thanks so much. Let's go ahead and review those.
Change much?
Where we did note a change, Attorney General Ford, is in the final three. It looks like one that may not have received a vote before did. So it would just be two recommendations that we would note as they were discussed but not ranked.
Okay.
And did the top 5 remain what they were? Eric shown for the record.
Yeah.
I will pull the other one.
Look like the tobacco thing moved up. I don't remember that being in the top 5. 1, 2, 3, 4.
Oh, yeah, you're right. I don't think I was up there before.
I'm gonna
Chair Ford?
I would just, yeah, go ahead.
I just wanted to clarify. So the top 5, that was what each individual member put forward, but there isn't any distinction in terms of the annual report about these are the top 5. It's just rank, here's the rank order. So I just wanted to make sure people understand.
Right, but the rank order, yeah, I hear what you're saying, but the rank order that we initially voted on is not the same rank order we're looking at right now. I mean, I think that's the point I'm making, but look, I don't think there's not much we can do about that. We need to vote on what we have here. I mean, that's, unless someone tells me otherwise, I think that's what we have to do.
Hey, Chairman, it's still a good list. I was just curious if it had changed, and it's still a good list. I'm comfortable with these priorities. Eric shown for the record, sorry.
What am I looking at? I'm saying.
On the left is the new one.
Yeah, this is Kelly Marshall for the record. 4 of the top 5 are the same. The first 2 are in the same order. PS4 moved up 1 spot above TRS 5, but TRS 5 shows up as number 4. So those 2 swapped.
Okay.
And PS7 is the one that went down. So supporting harm reduction went down slightly to the number 8 position from the number 6 position.
Okay.
RS1 is now in the 9 position. It was previously in the 8 position. So it looks like it's relatively close.
Mm-hmm.
I think that the major difference is whether you add in that recommendation that received 1 vote in the second prioritization process, but no votes in the first prioritization process.
So in the interest of transparency, and again, with everybody's names needing to be next to the votes, the motion that I will entertain is that we adopt this second list. And those last 2, we give honorable mentions to in the report.
So moved, Chairman. Eric shown for the record.
Could I get a second?
Jeff Iverson for the record, I'll make a second.
Okay, it's moving properly seconded that we adopt the second list with honorable mentions given to the bottom 2. Any discussion on that? Hearing and seeing none, all in favor say aye. Aye.
Aye.
Aye.
Any opposed? No, I'm sorry. Any opposed? Motion carries unanimously. Thank you so much. I felt like I rushed it down your throat, but I'm sorry. I think we had to do it that way. So thank y'all so much for your consideration on that.
Is it back to public comment?
Back to public comment. Yes, I'm looking at my.
Yeah, no, that's not.
Okay, all right. My counsel says I can go back to public comment. I'm going back to the last agenda item, public comment. Is there anyone else who wants to testify in public comment? All right.
Debbie Nadler.
Oh, Debbie, go ahead.
Thank you very much. I really think I need to talk to you in private, Attorney General. There's a one of our pharmacies is not going by, I thought we had restrictions about dispensing dispensing medicine. And I lost my son's best friend a month ago because a pharmacy kept filling his prescription when he was doctor jumping. Whoops, I'm storing my dog. So I don't know if this is something I need to talk to you about in private, but we've got a problem with one of the pharmacies here because he's not the only one.
Thanks, Debbie, for your public comment on that. Let's circle offline though. Thanks for the public comment on that.
Okay, thank you.
Thank you, David. Any additional comments for public comment? Okay, hearing none, then we will adjourn. Thanks, everybody. We'll see y'all in January. Stay tuned. Have a great afternoon.